Thanks, Sean and Alison and everyone for organising and attending. So this work may be a little bit tangential to some of the other discussions today because I'm barely going to cover any diagnostics. But I'm here to talk about a piece of work we were commissioned to do looking at how joint epidemiological and economic modelling has been undertaken in the UK around the COVID-19 policy response. And this was work funded by the NIHR Policy Research Unit in Economic Evaluation of Health and Care Interventions. Just quickly acknowledge my co-authors from York, so Anna and Mark, Sheffield, Andrew and Ruth, and Yasmina from UCL. So during, I guess, the past 18 months, modelling has become more into the public consciousness probably than any time in history. It's been more involved in central government decision making than we've ever known, or at least we've known about. However, there was a sort of view towards the end of last year that much of the modelling which was being used to inform policy and the debate was epidemiological modelling, very heavily focused on the spread of COVID, hospitalisations from COVID and subsequent COVID mortality. And actually the modelling informing policy, there was a little consideration of the impact on non-COVID patients' health or on wider economic impacts of the thing. So that was one of the reasons why we were commissioned to do this review of work. So just a sort of quick overview of the talk. I'm going to briefly outline some of the potential wider costs and outcomes of COVID-19 policies. I'll give a very brief overview of sort of economic evaluations beyond healthcare, just potentially a very large talk in itself. Quick overview of modelling, and then I'll go into our review, some brief conclusions and potentially some implications going forward for modelling. So sadly, over 135,000 individuals have died from COVID in the UK up to this time. And particularly during 2020, although also early 2021, the government instituted a number of non-pharmaceutical interventions, most notably lockdown and social distancing measures to stop the spread of the disease and reduce the number of deaths. So while these policies arguably were successful in those aims, they also had much further ranging impacts and costs. So some of those potential impacts include sort of health outcomes for non-COVID patients, and we're seeing that now in terms of delayed treatments, delayed and missed treatments, which I think we will be dealing with for years and with the current backlog. But then there was also the more direct impact on individuals' health, such as depression and anxiety caused by isolation. Obviously thrown very large amounts of healthcare resource use at COVID-19. So that includes expanding ICU capacity, expenditure on PPE, the lateral flow tests we're probably all used to taking now. Hot topic at the moment, obviously, is the impact on educational outcomes. Potentially, very large from school closures, maybe, potentially also very long term. Still very uncertain what the impact of those will have been on people's future lives. Other wider public sector expenditure, so obviously most notably the furlough scheme within the UK was incredibly expensive, but lots of departments have also had to spend on COVID measures. Employment and individual earnings. So yeah, the policies have potentially impacted people's ability to earn a living and subsequently their incomes. Similarly, private sector income, we've had businesses have had limits placed on their ability to operate, and and that's been further impacted by sort of reductions in consumer spending. And finally, sort of the more macro economic impact has been on GDP. We've seen a reduction in economic activity and very large falls in UK GDP. So from all that, it's COVID policy decisions differ to sort of normal economic evaluations decisions we look at in health technology assessment, because the impacts are undoubtedly very, very large beyond health. They can't be ignored. So that takes me on to my next slide, which is just looking at very, very quickly covering a very large topic around how to deal with economic evaluations beyond healthcare. So many of us here will be from sort of the HTA focus world, where we judge a treatment as of value to the population if it generates more health than would be generated elsewhere in the NHS by those same resources. So does introducing intervention X increase population health? And we've got well-established decision rules for dealing with that. We have a cost-effectiveness threshold, the maximum we would pay per QALY, and we've got a general rule that a QALY is a QALY is a QALY, but we're willing to make those interpersonal comparisons between the sort of known patients and the unknown patients who will not be treated regardless, who will not be treated if we fund this intervention. However, when you've got impacts beyond health, you need to think more broadly about the methods for dealing with them, and you need to consider, well, what are the outcomes we're actually interested in this case? And the outcomes to include is it's a normative question. So what should be of value? And there's obviously many different ways you can approach that question. One what we've routinely advocated is that it should actually be based on what the policymakers, people who are going to make the decisions at the end, want to know, and you should be able to. You need to think about when you're establishing what outcomes you're going to include in an evaluation. It should be thinking about what the policymakers will base their decisions on. Further complicated is that when you're moving beyond health, we've also got establishing impacts on lots of different outcomes, and that's it means modelling lots of causal pathways, modelling in areas we're not used to dealing with, which is just makes it probably even more challenging. And then we come into sort of aggregation social value issues about when you have multiple outcomes, when there are winners and losers, that's either in terms of individuals or where we gain in health and lose in education. We need to think very explicitly about what the trade-offs are and what trade-offs we're willing to accept. And still one of the sort of major issues in economic evaluation is that we have no universally agreed way of valuing different outcomes. We do not have a universally accepted social welfare function, which we can just plug in and say, yes, this is state X of the world is better than state Y of the world. So we need to be very explicit about thinking about that when we are doing these sort of wider evaluations. So just quickly onto the role of modelling, and I'm sure many of you will be familiar here. Modelling provides an analytical structure to synthesize evidence from different sources, so that we can estimate the cost and outcomes of the different policy options we're considering. It makes explicit the scientific and value judgments made in the analysis. In the modelling I'm going to talk about today, I've split it into two, which I'm not always happy with the distinction, but we'll go with epidemiological modelling is providing the framework to sort of estimate the spread of the disease and the impacts on patients' health. And economic modelling has been used to estimate the wider effects, including sort of costs, resource requirements, and then also to compare those to the opportunity costs. So ideally, we'd have a model which is consistent across domains. So we've got an epidemiological engine which is driving both the health and the wider economic effects. And there's also always a trade-off between sort of simpler versus more complex modelling. The greater the complexity, the larger the evidence requirements, the greater the computational requirements, but also potentially the greater the flexibility and ability to capture the impacts we're interested in. So in terms of the review we conducted, so we were looking at joint epidemiological and economic modelling conducted in the UK around COVID policy decisions. And this review was conducted in late 2020, so it's quite outdated already. And we were looking to identify UK studies that included an epidemiological model and at least one of these following components. So either it captured NHS costs, it captured something about the health of non-COVID patients, it captured something about impacts on other public sectors or on private sector. It captured impacts on individual economic outcomes, which range from wages, productivity, private consumption to sort of utility welfare, or it brought in monetized values of avoided COVID fatalities. And from each of those studies, what we were looking to identify was what was the modelling approach taken, what were the policies they were considering, and what were the outcomes they were considering. So this slide just very briefly covers the actual review searches we undertook. So the searches were conducted in about November 2020. So I missed out the year here, unfortunately. And so I'm aware that there have been lots of very relevant UK literature since then, but unfortunately it wasn't available at the time. At the time, much of the work which I will discuss was in pre-publication repositories or in the grey literature. And and also highlight that the review was rapid. It's a pragmatic approach, but our search strategies may have missed things at the time, but this was a piece of work we were commissioned to do on behalf of government. So there's a reason why we had to undertake it in a very short period of time. So just briefly just outlines the review we undertook. So we identified 779 papers through our search strategies, and one paper was provided via personal communication, which was a SAGE paper. Of those, 25 made it through to full text review, and then 11 met our inclusion criteria and were included in the review. And this slide just quickly covers the papers. Won't go through them now. If you are interested, we have a publication in pharmacoeconomics, which I can share the link for, which details all of these references. So in terms of the modelling approaches taken, I'm not going to go through and discuss the different approaches to EPI modelling, as there are far better people to do that than me, and there are extensive reviews of the alternative EPI models for COVID. So what I'm instead going to focus on is how they extended the modelling to look at some of these impacts we were interested in, so the non-COVID health impacts and the economic impacts. And we sort of split the models into three categories. First of these were the health-only models. So these were models which capture the health impacts of COVID and some of the health impacts of policies on non-COVID patients, but did not in any way attempt to capture wider economic outcomes. The second set are health and individual outcome models. So these capture the impact on individuals' health and their own economic outcomes, such as wages. So, for example, if an individual is ill, they can't work, and it captured their reduction in wages and consumption resulting from that. However, they didn't then try and link that, what the dynamic effect of that was potentially on other individuals' economic outcomes. And then we have this third type of model, which is the more comprehensive approach, which were effectively linking EPI and macroeconomic models, such as general equilibrium or input-output type models. And I'll go through them in a little bit more detail. So in terms of the health-only models, relatively common approach to capture the impact of COVID and the impact on COVID patients' health across these models. It was an EPI model, which captured infection, and the health of hospitalised patients was also then impacted by hospital resource constraints, such as ICU capacity. And that was quite standard across all of them. The approaches to capture the health impacts on non-COVID patients were a little bit more heterogeneous. So you had some which I'll try to argue the better, more interesting models, where they were explicitly linking the epidemiological model through to the impact on non-COVID patients via things like modelling the lack of capacity for treating a limited subset of other patients. So one of the examples was ICU capacity would not be available for road traffic accident victims or other accident victims. You then had what I guess is sort of more HTA economic evaluation type models, where the impact on other patients was captured via costs falling on healthcare budgets, displacing other non-specified healthcare for all potential patients. So more what I've labelled here is the sort of cost effectiveness approach. And finally, you had, which slightly more disjointed approach, which is the sort of just the wider effects of policies which impact health. So this is where the EPI and the COVID epidemiological model and the non-COVID impact were separated and just brought together in an aggregate at the end. And so just capturing things like, oh, well, what do we expect the impact of isolation and depression to be on patients? What was the impact on the reduction in traffic accidents? What was the impact of the reduction on air pollution on the health of non-COVID patients? And just brought together to aggregate them at the end. So obviously some of these models more directly linked the EPI to non-COVID, and others were just taking external evidence. So in terms of ways which they captured wider economic effects, so the simplest approach, which I didn't actually cover on the original modelling slide, was effectively, you had the EPI model, which produced all the results around COVID cases, hospitalizations and mortality, and you took the results from that, and then you just stuck next to it some data from some other data around, which were estimated separately, such as what was the impact on GDP or on consumer spending and so there was no direct link between the two. And then you've got these two alternative, broader approaches for linking epidemiological models with wider outcomes. The first of these is the one where you model the health of individuals and the restrictions imposed on them and how that links to their individual wider outcomes. So, as I mentioned before, if an individual is sick, they can't work, or if you are limiting their ability to work because of restrictions on it, that impacts their wages and their consumption. However, there was then no attempt to dynamically link how the impact on one individual potentially then leads to another. So if I had a reduction in wages, I would reduce my consumption, which would then potentially, which means that, so I'm not spending much in another business where they will therefore have to potentially let's lay someone off. And then you have the more comprehensive approach, which is where models were capturing, which was where they were linking epidemiological and macroeconomic models, so that you're actually capturing how the epidemic was filtering through dynamically into the rest of the economy. And there was different approaches to that. There was general equilibrium models, input-output models, and there's a large field and a lot which can be covered in that area. So this slide just quickly covers some of the interventions which were considered in the papers we looked at, and so you'd be familiar with a lot of these now. So obviously, just the unmitigated pandemic was often a comparator. So the no intervention, lockdowns, which were varied by sort of time when you actually started the lockdown, the length of the lockdown. One paper also looked at the potential for sort of geographical, regional lockdowns, test and trace, and different forms of test and trace. So whole population versus symptomatic cases, sector-specific closures, so closing of hospitality, face coverings, social distancing, virus visas, which are something that's aware. Well, actually, we're not thinking fast, but where pre-vaccination it was around whether a patient had previously recovered from COVID, and they may be given some additional freedom. And then you have these two more general catch-all strategies, which is a combination of non-pharmaceutical interventions, which is mitigation, which is to keep R as low as possible, and suppression, which was to keep R below 1. And then I guess to show a sign of the times, at the end of 2020, only one of these papers considered a vaccination strategy. Whereas obviously that would be a key policy now. This slide just quickly covers the different policy options covered in all the papers. Obviously, they range from having 2 alternatives up to 31. None of the papers covers all the different policy options. So this slide just sets out the outcomes, which I've just split them out here into sort of health-related outcomes, sort of COVID and non-COVID, and then the non-health outcomes, which I've split into sort of macro and individual. So in terms of COVID health outcomes, it's infections, hospitalizations, ICU hospitalizations, mortality measured in alternative ways, and then QALYs, although that was a very small subset of papers which included QALYs. Similarly for non-COVID, ICU hospitalizations, mortality, deaths and life years, and QALYs. For the non-health, we had the macro outcomes of overall GDP loss or gross value added, which is a sort of sector-specific measure of value. And then at individual level, we had sort of earnings, consumption, and then these sort of more welfare utility-based measures, which include consumption, but also potentially include sort of loss of freedom and isolation, what's a welfare loss in value of a daily life. This slide quickly covers which of the outcomes were covered in each of the papers and the cost and resources, but given time constraints, I won't spend any time on it. So some brief conclusions from the review. So at the time, probably very different now, there were very few modelling studies which had looked at the impact of COVID in the UK on non-COVID health and or wider economic outcomes. There was considerable variation between studies in the modelling approaches taken. Some were very linked, EPIs was very linked through to the economic outcomes, others much less so. There was variation in what impacts they were capturing. I think there needs to be more consideration about what decision makers actually wanted to be captured. The policies considered varied. I haven't had time to talk today, but about the sort of values used to inform decisions. What decision, were they aggregating costs from the healthcare system with productivity costs and sticking it against a nice threshold to try and make decisions? And is that appropriate? And there was very little sort of consideration of decision uncertainty. And then So just some sort of potential implications going forward. So there should always be careful consideration of the modelling approach for future policy evaluations, and different modelling approaches will be more suitable for particular policy options. Models, you may need more granular models than were available here. Particularly when we were looking at the time, none of the models would really have been able to model the tier allocation system, if everyone remembers that. However, obviously, desired granularity may be difficult to achieve, and consideration needs to be given to the sort of feasibility of the modelling required. And sort of as with all evaluations and all modelling, model choice should always be focused on the main factors relevant to decision options, which, what are the outcomes of interest? What are the policies we're interested in? What are the sectors likely to be impacted? And what are those causal pathways? I guess just to close on it, I say these are sort of potential policy implications going forward and for sort of modelling COVID. Depends on who you believe, but many people are now saying, COVID is moving more towards being an endemic disease. We're less likely now to have these sort of wide-ranging non-pharmaceutical interventions which impact across the economy. So it's potential that maybe we are moving more back to just COVID will be treated via healthcare interventions, and as such, we might not need to differ from the sort of HTA focused norm. But these are just if it's all going to fall on the NHS, we may need to consider less these sort of wider outcomes.